Welcome back to First Move. Could artificial intelligence, AI, be a way to support the overwhelmed medical staff around the world? Doctors in Wuhan used AI to detect signs of pneumonia associated with COVID-19. It was adapted from technology previously used to spot lung cancer. The software was created by the startup Infervision, and the CEO Chen Quan, who likes to be known as CK, joins us from Beijing. CK, great to have you here on the show. My understanding is your staff in Beijing spent the Lunar New Year holiday tweaking and tuning the algorithms to spot pneumonia associated with COVID-19. Is that correct?
Yes, that's basically correct.
Wow.
So we have been working with a few hospitals in Wuhan area prior to the outbreak. So basically they have been our long-term users for our lung cancer screening artificial intelligence. And then while we see the outbreak coming up, we basically talk and work with hospital doctors and see how we can actually use our AI technology to help them fight off this virus. And that's basically how our team worked our Lunar New Year, try to create this artificial intelligence.
So just so I understand, you put this into 34 different hospitals, and as the patients come in, it just helps the frontline medical staff because they can quickly scan the person's lungs and go, this is probably someone who's got COVID-19 versus someone who perhaps has got flu or is suffering from something else.
Yes, exactly. So basically, our artificial intelligence analyzes CT scan to help doctors identify suspected COVID-19 cases to help prevent further hospital transmission and cross-infection. As we all know that the COVID-19 is highly contagious, and the ability to identify highly suspected cases is extremely important to stop the chain of infection. So from early experience that we work with in China, we see that, for example, PCR testing is definitely the gold standard to confirm the presence of COVID-19. But PCR testing suffers from low availability, and it can take a really long time to accomplish. And there have been some known cases of having false negative cases. So doctors in China has been utilizing CT scans with the help of artificial intelligence to help identify who has the suspected COVID-19 pneumonia symptoms quickly. And then they can start the quarantine, they can start the isolation, they can start the observation quickly while waiting for the PCR test, so that we can actually prevent further in-hospital transmission as well as when they go back home and transmit it to their family.
It's incredible. There will be people watching this going, the reason why China can do this, though, is because you guys can collect the data required to feed into the algorithm and the system to simply be able to identify this. Would you agree with that? And is this something that perhaps you could provide to other countries, just using your data and knowing what you've collected already has a good target rate of finding this kind of anomaly, that the pneumonia like in lungs?
Yes, we basically feed our AI with early cases of COVID-19, especially in Wuhan. And then when the virus basically spreads to the rest of the countries, we deploy our systems in even more hospitals. And I think the beauty of artificial intelligence is really that we can actually train the AI and we can deploy it to other places even faster than the spread of the virus itself, especially in some of the rural and remote areas. For example, those healthcare workers, they've actually never seen any COVID-19 cases, but they're preparing for it. But with the help of AI, they can now help to recognize the virus. So I think this is really the true beauty of AI.
Talk to me about whether you are talking to other health authorities that this could be perhaps used here in the United States, in the UK, even in Italy, where we're seeing some of the fiercest outbreaks here. And CK, my second question here is, I know you have workers in the Hubei province. How are they doing?
Yes. So with respect to the first question, we are already deploying our system in Japan, in Italy. In fact, we have been working with the largest teleradiology group in Japan and deploying our AI with DoctorNet for doctors in Yokohama area where the crews park. And we have also deployed our AI system in Italy, helping doctors there to fight off the COVID-19 virus. And we are definitely looking forward to deploy our systems in US and even more countries in Europe. And we have a few employees in Hubei, and they're still there. And we actually very concerned about them, but so far they've been very good, and they've been working with us to fight off this virus. Thank you very much for your concern too.
Noel, thank you so much for joining us. Incredible work from you guys. It's just The power of data and the power of AI explained. CK, Chen Quan there. Keep in touch with us, please, and let us know how they're doing and how you're progressing around the world. The CEO of Infervision there in Beijing. No, thank you. All right, still ahead. Tokyo 2020.